Let's talk about how you might know you are a patterned individual without actually being tested by a professional such as myself. So, I'm talking about people that have been dealing with chronic pain with no rhyme or reason as to why, in terms of, oh, my doctor said it wasn't for any specific reason that they could find, and physio and or physical therapy, other medical professionals can help. This video is 100% going to be for you, so please pay attention and listen up. So, without testing, we can kind of gauge things based on postural analysis. And we're going to talk about left AIC in the lower body, stuff you might see, right BC in the torso, stuff you might see there as well, and right TMCC in the cervical spine and cranial bones, stuff you might see there as well. So let's start with the lower body. So I'm going to start with this unedited picture of me from a couple years ago on the front view. And then I'm going to crop that and take a lower body picture that's edited and leave this on the screen as I talk. So first thing and easiest thing to kind of see is going to be the hips for most people. So if you take a picture similar to this of yourself, hips are the first thing you're going to look for in terms of left AIC, just standing static posture. So this is not going to be for everyone, but the vast majority of people are probably going to end up with a hip hike going up to the right and hips sinking to the left, or hip sink on the left. And here's why. When your pelvis is rotating counterclockwise, totally wrong, clockwise, when your pelvis is rotating clockwise, what's happening is that your left pelvis is coming forward and your right pelvis is going backward to some degree. And when you have this transverse plane effect that's going to make it seem like, okay, this left leg is going forward, this right leg is stable, right? So when that left leg is going forward and we're stabilizing on our right leg, all of a sudden what's going to happen is that our left leg is going to look like it's sinking, because that's kind of what's happening as you're in that swing phase, right? You're sinking for a bit, you're shifting, and then all of a sudden you're there on your left leg. So that's the first thing I'd look for, and I know that's a bit of a drawn-out explanation, but I like to give people depth in terms of what we're talking about here. Next thing you should see in that picture is probably the knees. So the knees are a little bit complicated, but basically what you might see is having knee valgus on the left, which is basically just having that knee follow that left foot, where it's going down and kind of sinking down and in, and that right knee sinking up and out, or not sinking, going up and out is the better way to put it. That's a hard thing to spot. What I'd recommend more is just taking a look at the feet and seeing if that left foot is pronating, and that right foot is supinating. So if that left foot is sinking and that right foot is going upward, or pronation, supination of those feet correspondingly from left to right, that's going to be problematic and generally be a very good indicator of, hey, my mass is shifting over to the right. And just standing like this, you'll kind of feel that right arch come up a little bit, while if you shift to the left, you'll probably feel that left arch coming up a bit. Now, you're not really going to see plantar fasciitis without actually experiencing left foot pain, specifically plantar fasciitis for that left foot. So what I'd recommend doing, especially for the knees and the feet, is measuring leg length. And what I would do with that is simply just say, logically speaking, if your left leg is longer than your right leg, very good indicator, because again, that right hip and that right leg, they're coming up. That left leg, it's coming down, it's flattening, it's sinking into the ground a lot more, right? That left leg is kind of almost on a downward trajectory, like walking down a hill, versus that right leg is more on flat ground. So you're very likely to see a discrepancy in leg length with a left leg that is going to measure longer, probably by a centimeter or two at least, than that right leg. So that's what I'd look for in terms of lower body to look out for left AIC symptomology. Okay, let's talk about right BC, and this time I'll use pictures of myself from the front and back to kind of discuss things. So we'll start with the easy stuff. Right BC, unedited picture of me a couple of years ago again, And let's talk about edited torso picture from a front view right here. So there are two things I want you to pay attention to. First, that's kind of obvious, is that line on my shoulders with that left shoulder being higher than that right shoulder. This is happening simply because that right rib cage is coming forward and that left rib cage is coming back. It's giving the illusion that your left shoulder's higher than it actually is, in the same way it's giving kind of the illusion that your left hip is actually lower than it is. But really what it is based on transverse plane rotation. So counterclockwise rotation of the torso. You're going to have that right shoulder come forward. That left shoulder is going to look taller by virtue of the fact that your sternum is rotating this way in a counterclockwise motion. So that's an easy thing to spot, in my opinion. Just that line, draw a line on your shoulders, shirtless or no shirtless or with a shirt, and see if you can find anything. The other big thing, and this one you actually probably do need to have at least like ab wall exposure for in terms of frontal view, pay attention to your ab walls. So if you see a lot of compression on that right side, very, very common. Because again, if we're on our right side all the time, you have to imagine that this ab wall is going to be locked up. Lots of air over here, not very much air over here. We're going to have tightness over here and openness over here based on the virtue of the fact that we are over here, A, and B, based on how that rib cage and thoracic spine are rotating counterclockwise. Very similar to the lower body. And now we're going to flip that picture around, back view, and you're going to see a bunch of arrows and kind of directionality of how the scapulae are moving. Not going to get into it too much. Basically what you should know is that if you feel like you can have someone just you line your back and have someone kind of feel out your scapulae, what you're very likely to find is that right scapula is going to feel more prominent, especially on that medial border. So basically what I'm saying is that that right scapula is going to be winged a lot more. It's going to be coming up like this, and that left scapula is going to be the opposite of winged, where the lateral border of the scapula is kind of coming off with that left scapulae, and the medial border is coming off with that right scapulae. So if you take a picture and your scapulae kind of look like the picture presented here in an edited format, then you are very likely in right BC. But because that's very hard to spot for most people, what I'd honestly recommend is just having someone kind of feel out your scapulae and asking, do you feel a prominent difference between my right scapulae and my left scapulae? If they tell you that your right scapulae, especially on that inside part, that part that's closer to your spine, close to the midline of your body, is more prominent and kind of bony, very, very good sign that you are in right BC. So that's kind of the torso. And that's a very brief summary of kind of what I'd look for in the torso. Here's where things start to get a little more complicated. We're going to talk about right TMCC. And really with this, what you kind of need to know is that there's going to be compression on that right side of your neck between your atlas and occiput. Your atlas and occiput are going to counter-rotate over one another. Not going to get into too many details. That's a discussion for a future video. And then you're going to have your occiput rotate one way, your sphenoid bone rotate one way, and your temporal bones rotate another way. And the reason I'm saying all this is because the way those bones rotate are going to affect how your face looks. And what's going to happen with your face is that it's going to have fullness on the right and kind of a closed off look on the left. And here's why. You're going to have that counterclockwise facial rotation, generally speaking, at least in right TMCC. There are variables like right torsion, which is pathology of right TMCC. Again, discussion for the future, another video, but try to take a look at this picture of someone in right TMCC and tell me a few things you see. A more prominent and flared left ear potentially. You might see a bigger right eye, raised right eyebrow. Sometimes if you're really good at spotting stuff in the neck, you'll see bilateral or more right SCM activity. So the muscles kind of here will start to tense up. But again, just take a look at that face and pay attention how it's rotating counterclockwise, especially with that jaw being very prominent in terms of the way it's moving to the right, I believe, generally speaking. Or no, sorry, not the right, the left, I believe. Yes, it should be the left that the jaw is moving to, like this, counterclockwise. Okay, and that is what I have to say on the subject. I hope this video was informative, and please feel free to check out more of my stuff.